Good Sunday morning, each and every one of you. Glad you're here. This is the second week of our ministry fair where we emphasize the importance of ministry in the Christian life. We had a meeting yesterday with all the ministry leaders in our church, and we gathered together to talk about ministry and the ministries that are available at our church and what's going on as far as serving Christ in the church, serving Christ in the community at large. And we had a great meeting with those guys, and you'll see a lot of the booths set up around that show the ministries that are offered by our church, and it gives us all opportunities to serve. But I want to tell you, it's not just ministry here in the church, and it's not just ministry here in Clarksville that we're involved in. We're in ministries around the world. And it's kind of cool that this little church has touched people around the world through the offerings we give, through the people in our church who have traveled overseas. We've had a lot of those, nearly 50 to date, who went overseas. And we have just a lot of ministries that are involved in that. And this morning I would like to introduce to you Mr. Bill from Fame, which is another international ministry that we are supporting. And I'm so proud to have him here with us today. Mr. Bill, I turn it over to you.
Thank you very much. It's great to be here with you today. We are very grateful for your partnership with us at Fame, financially and with your prayers and your encouragement. And I know Fame is new to many of you. I hope that by the time you leave here today, you'll have a good understanding of who we are and what we do. I want to start with just some scripture. At the beginning of Jesus' ministry, he gathered the 12 who would be his closest followers, and he spent time with these 12, and he taught them and he trained them. And when he sent them out for the very first time, Luke tells us that he sent them out to preach the kingdom of God and to heal the sick. And we see this repeatedly in Jesus' ministry. In Matthew chapter 9, we see where Jesus went through all the towns and villages, preaching in the synagogues, proclaiming the good news of the kingdom, and healing every disease and sickness. When John the Baptist was in prison, he sent two of his followers. He said, "Go and find Jesus and ask him, 'Are you the one who is to come, or should we expect someone else?'" And Jesus told these two, he said, "Go back to John and report what you've seen and heard. The lame walk, the blind receive sight, the lepers are cleansed, the deaf hear, and the dead are raised, and the good news is preached to the poor." So over and over and over in Jesus' ministry, we see these two priorities, preaching the kingdom and healing the sick, how they go together hand in hand. And Fame is based on that principle of ministry. We call it medical evangelism. It's meeting the physical or healthcare needs of people for the purpose of gaining an opportunity to share the gospel. Jesus knew that when people were sick, when they were in pain, when they were suffering, and you bring help, that they are open to hearing what you have to say, maybe more so than at any other time in their lives. And so it's a principle of ministry that Jesus used, that the apostles used, and that we still use today, and it works. Let me give you an example. This is Natalie. I met Natalie when I visited the mission clinic where she works in Bengaluru, Ivory Coast. And the work of that clinic, to a large extent, is treating patients with HIV and AIDS. And they have something over 2,000 people that come to the clinic every month, and they have their blood drawn and tested, and they receive their medication. And what we know now is that even in a place like West Africa, that if you have the proper care and the proper medication, that AIDS is a disease that can be managed. It can't be cured, but it can be managed. And they are doing that in a terrific way. What Natalie does as a part of the work of the clinic is Natalie works with expectant moms who have HIV and AIDS. Now, if you had asked me, I'm not a medical person. 2 or 3 people have asked me already this morning, "Are you a doctor?" I'm not. But if you had asked me before I started learning about this, if a mother with AIDS gives birth to a baby, will the baby have AIDS? I would have thought yes. I would have thought, okay, they share blood. I would have thought yes, but I would have been wrong. What Natalie does is work with these mothers to prevent the transmission of the HIV and AIDS virus from the mothers to the babies. And there are things they do. There are medications they use during pregnancy. There are protocols they follow during delivery. You know, in West Africa, most babies are born at home. These babies are born in the clinic, and they take special care during the delivery. And even up until the time the babies are 2 years old, she continues to work with these moms and coach them and teach them to how to protect their babies. And when I first met Natalie 2 or 3 years ago and learned about this, they told me that they had a 90% success rate at preventing the transmission of HIV and AIDS from the mothers to the babies, which is tremendous. That's a great success story. More recently, I actually saw, and I have to see this, I don't have these numbers memorized. I actually saw this was on the Ivory Coast Clinic's Facebook page. And it said they treated 2,675 HIV patients at the clinic, and that there were 47 babies born in the maternity clinic, and that they had 100% success at prevention of mother-to-child HIV transmission. That's amazing in a place like West Africa that they can do that. But you see, that's only part of the story. The other part of the story is that Natalie is an evangelist. Natalie holds Bible studies with the ladies that she works with. She goes to their homes and she gets to know their families, and she teaches them and she prays for them and with them, and she brings them to church. And Natalie is using a physical need as a way to gain access to families with the gospel. That's medical evangelism. So what we do at FAME is we're based in Indianapolis, Indiana. We have no staff overseas, but we work in partnerships with people like Natalie in the Ivory Coast Clinic, and we work in over 40 countries around the world supporting people who are doing medical evangelism. Let me give you some examples. We support what we call sustainable healthcare projects. So in 1947, there was an American couple from Nebraska, Charles and Roberta Selby, that left their home and they went to the Philippines. And, they went to San Francisco and they got on a ship, and it took 6 weeks on the ship from San Francisco to Manila. And somehow when they got to Manila, they found their way all the way up to the very northern tip of the Philippine Islands to a town called Apari. And it's a little bit of a challenge to get to Apari from Manila today, but I don't know how they got there in 1947, but they did. And when they got there, they planted churches. They started a Bible seminary that is still active and functioning today. And at the very end, they stayed there for 50 years. And at the very end of their time in the 1990s, they started a hospital. And they called it Apari Christian Hospital. And as soon as they retired and left and came back to the U.S., they changed the name to the Charles W. Selby Memorial Hospital. He was determined they shouldn't do that, but when he left, they did it anyway. And so when this hospital, by the way, it's a very beautiful place. You can walk from the hospital to the beach on the South China Sea. And when the hospital was built, it was a 2-story building. Later on, they added the structure for a 3rd story, and just within the last couple of years, FAME was able to help provide funding to complete the 3rd story. But the greatest thing that Charles Selby did is that when he retired and came back to the U.S., he turned the whole operation over to the Filipino church. So today, if you go there, the hospital board of directors, the hospital administration, all the doctors and nurses and staff, they're all Filipino Christians. And this hospital, yes, isn't that wonderful? And the hospital is almost totally self-supporting. So we still help them with capital projects and with acquisition of equipment, but as far as their day-to-day operation, they're almost totally self-supporting. I was just there 2 weeks ago, and they had an outbreak of dengue fever. And the hospital was packed. There were patients in every room. There were patients in the hallway. There were patients in the lobby. There were patients in the conference room. It was packed. but they are doing a tremendous work of medical evangelism. They have two chaplains on their staff, Frederico and Orlando, and they're both friends of mine, and I've gotten to know them, and they do a tremendous work with the patients and the families. Early last year, we did a brief survey of some of our partners, and we asked 2 questions. And the first question was, how many patients did you treat last year? And the answer we got from this hospital was 14,600. And the second question was, how many of those patients heard about Jesus during their experience at your facility? And the answer was 14,600. And so they're just doing a tremendous work of meeting physical needs and then meeting spiritual needs. While I was there, I walked to the beach. So one morning I got up and I walked to the beach, and this guy along the street stopped me, and he said, what are you doing here? When I go to a place like the Philippines, it's obviously I don't belong, okay? And they think I'm a giant, and I actually preached in the service at the hospital 2 weeks ago today, and my sermon was on David and Goliath. And they think I'm Goliath, okay? So, but I'm walking down the street. This guy stops, and we had a conversation. He said, what are you doing here? And I said, well, I'm visiting some friends at the hospital. He said, and this is totally unsolicited, a total stranger. He said, oh, that's a great hospital. He said, anybody that needs help wants to go to that hospital. There are 2 other hospitals in town. Nobody wants to go there. While I was there, a patient transferred in from one of the other hospitals. On the form, the reason for transfer, it said, was because the other hospital was dirty. So they're just doing tremendous. I just wanted to show you a couple of pictures. In the new space that was recently finished, this is their brand new laboratory and the lab staff. I know they all look like teenagers, but they really are trained, highly trained adults. This is their operating room. Part of we made a shipment at the time that this new space was open. The anesthesia machine there in the corner was part of that shipment that we were able to provide. I got to speak for Monday morning devotions at with the hospital staff, and this was the picture they took after that. You can see how I kind of stand out in there. But that's a great, just a terrific example of medical evangelism and of sustainable health care. We don't provide monthly support. We don't pay any salaries. We don't buy their medicines. They do all of that. But we encourage and support in any way we can. So I know we have limited time this morning. I can't talk about all of these different projects, but we have projects like that one in India, in Pakistan. Pakistan obviously is very resistant to the gospel, very unfriendly to Christians. But the Pakistani doctor who is leading this project is determined that it will say Good Shepherd Christian Hospital, and there will be a big cross over the front door. And you can see this is that building currently under construction. This is in Haiti, in Kenya. Kelly and I, my wife Kelly is here with me. We got to go to Kenya for the dedication. This is a medical lab that serves 9 clinics in western Kenya. It was just dedicated in October. In near Manila, in the Philippines, there's a place called Bacoor City. One of our partners has a ministry in Bacoor City, and there are basically homeless people who can't find a place to live, and so they go out over the water and they build houses, bamboo houses on stilts over the water. And that's where they live, and it's like a maze. We walked through these bamboo sidewalks over the water, through these houses, and it's quite an interesting place. Tremendous need. There's no sanitation. If you can imagine living in a house over the water, and your only sanitation facilities is a hole in the floor. And then we see children swimming in the water below. I mean, it's gross, it's disgusting, but it just points out the tremendous need for health, education, and medical care. We help provide this vehicle. There was no place, literally no place to build a physical clinic, and so we help provide this vehicle, and they're using this vehicle to go out into these areas, in these neighborhoods, and hold medical clinics and do outreach events to meet the physical and the healthcare needs of these people. And planting churches. They now have 5 churches in these areas of such great need. Simon Thong is a friend of mine, one of our partners in Myanmar or Burma, and he posted this on Facebook. He said, "Thanks to Fame and Cameron for partnership in establishing Mulashidi Hospital in Patau 10 years ago. It is going well, self-supporting without receiving foreign help." That's the goal. That's what we mean when we talk about sustainable health care in developing countries. And it's a difficult goal, and it's an elusive goal, but it can happen, and it does happen. And we're glad to be part of that. So we have projects like this going on in a number of places around the world. A kind of a project that we have is our scholarship program. We provide scholarships for bright young men and women who are going to medical school in their own country, again, for the purpose of building sustainability. We'd rather they're dependent on their own doctors rather than being dependent on our doctors. So this young lady, her name is Meetali, and she is now a doctor in India, went to medical school on scholarship from Fame. These two are nursing students in India currently, and on scholarship from Fame. And we have a number of we have about 15 students currently receiving scholarship from Fame to go to medical school, dental school, nursing school in various places around the world. So we operate this warehouse in Indianapolis, Indiana, where we receive donations of medical supplies and equipment almost every single day. And we have volunteers that come in and help us process all those donations. We enter them into our inventory system, and we ship them to our partners all over the world, many times on large shipping containers like this, sometimes smaller quantities, a pallet, a crate, a box, or a suitcase. We find people who are going overseas, and we ask them, will you carry an extra suitcase with you with these supplies that are desperately needed by our partners there. Last year we made 130 shipments to 33 different countries. So this is a group of people who have just loaded this container. It was going to Uganda. And they got everything inside, they closed the doors, and then they gathered around, they put their hands on the container, and they prayed. And they prayed that it would get there okay, and it prayed that it wouldn't get stuck in customs, and which sometimes happens, and all of that. But they prayed for medical evangelism, because the stuff that we send is for that purpose. It's used by our partners to do medical evangelism. We hope that because of this stuff, somebody's going to come to a clinic or to a hospital looking for help with a physical need, and while they're there, they're going to hear about Jesus for the very first time. And that's the purpose. That's why we do what we do. So besides the projects and the shipping, the third major thing that we do is that we put together teams of people to go on short-term mission trips to work alongside of our partners. This obviously is a boat. This boat travels on the Amazon River and its tributaries through the rainforest in Brazil. They go to village after village after village that are not accessible by road. If you want to get there, you have to go by water. And they'll go and they'll tie up at the dock at a village. And on the first level of this boat is 2 medical exam rooms, a dental office, and a pharmacy. And on the second level is sleeping quarters and dining room. And so our team lives on the boat for about 10 days. And they go to a different village every single day. And they meet physical needs, and they share the gospel. Now, we believe that the purpose of every short-term trip is to have a long-term impact. We're not satisfied with going someplace and just meeting the need for today. What happens tomorrow? What happens next week? What happens after our team goes home? And so our goal is always to leave behind something that has a long-term impact. And many times, in our case, what that means is health education. What can we teach? What knowledge, what skills can we leave behind, particularly with the national church, that they can use to help others in their community when we're not there? I have kind of this nightmare, the recurring nightmare that people are getting sick when we're not there, and somebody says, well, maybe when the Americans come back, they can help you. No, that's not the idea. What we want them to say is, when the Americans came, they taught us what to do, so now we can help you. And then the national church is empowered to serve their community and help others in a way greater than they ever have before. There are a number of ways that I would invite you to be a part of what we do at FAME. And first of all, I would just ask you to pray for us. On the FAME website, which is fameworld.org, there's a prayer calendar that just asks for prayer for one item each day of the month, and then there's a new one the next month. And so if you are a praying person and you would commit to pray for FAME, I just offer that as a resource that you could use. Also, like every other mission organization that you know, we depend on financial support from churches and individuals who believe in what we do. And we're grateful for the support we're receiving now from Gateway. Look forward to a long partnership together. We have a thing called the Cardboard Pharmacy, which is a way to collect over-the-counter medicines that are readily available here, but not so readily available in a lot of the places we go, and that's a way that you can help. Much of the work that's done at FAME is done by volunteers, and so we invite you to come and work alongside of us. It's about 4 hours and a half from here to Indianapolis, and we have people come from all over and spend a day or two working in our warehouse. It's fun. We have jobs that anyone can do. We have heavy lifting jobs out in the warehouse. We have jobs where you sit at the table inside in the air conditioning and sort things on the table. We have jobs for everyone. We have senior citizens groups. We have youth groups. We have all kinds of groups. We have college groups that come and work. And so we invite you to come and work alongside of us. And then finally, we're always looking for people to go on short-term trips. It's not, you don't have to be a medical person. There are jobs for everyone. Typically, our teams are between 1/3 and 1/2 medical people, and the rest are just volunteers who are willing to serve as needed. And we have a little display table over here with some information. Kelly and I would love to talk to you after the service. Thank you for allowing us to come, and we look forward to partnering with you through the future. Thank you very much.